Hello, this is Alicia Marr. I'm here again at one of our Excelin locations, our San Diego location, and I have with me Tess, who is one of our clinical managers here.
I'm the
patient care coordinator here at our San Diego location. So, Tess, just give us a little bit of understanding about how you started with the company and how long you've been here, what roles you've been playing already.
Okay, I've been here for 2.5 years now. I started off as a field nurse, and a year into my employment with Excelin, I was called into the office and offered a position as the patient care coordinator here in San Diego.
And how long have you been working that role?
I stayed in the field and kind of did both while I was learning for about 6 months, and then I've actually been in the office doing the role as PCC for the last year.
And being the patient care coordinator, what are your primary responsibilities that are attached to that position?
I review physician orders. I make sure that the nurses are aware if there are any special needs that the patient has. I make sure they have their supplies. I make sure that if there's any special needs that the patient needs, that I find a way to get that to them.
Okay, so you're supporting both the patient and the staff members that we have in the field, which is very important. So thank you for that. What was one of the things that brought you into the home health setting? It's, you know, a practice that doesn't resemble anything else in healthcare.
No,
so
it doesn't. I actually was working in home care. I was doing pediatric vents. I threw my resume up on Indeed. Didn't expect to have anybody give me a call about it. I wasn't putting in any applications. I just kind of posted my resume. I received a call from Kathleen, and she was very persistent because, like, the first month I just ignored her, and she just was persistent. 6 weeks later, she called me and she said, "I would really like you to come into our office and just talk to me." And so I came into the office. I talked to her. They offered me a position the next day, and 2 days later, I think I took it.
okay, well that's great. Thank you. We're always so grateful for our team members that, you know, have walked a good journey, both in the field and then as they've advanced into the organization. I think that's part of our core culture, is to try to advance from within when we can, and we're so glad that that was a successful, you know, step for you in your career path that you have here.
And it's been great because this is one of the first companies where I've actually felt appreciated.
Oh,
And I felt like I could advance. Normally, as an LVN, you're an LVN wherever you are, and that's just where you are. And I'm here. It's, you know, I've been able to go from the field to the PCC role, and I'm going to further my education with the support of Excelin, and hopefully get my RN so that I can be in one of the managers.
that's a great position, and that's definitely part of our goals as a company, is once we identify committed clinicians within the organization who want to further their career path or advance their position within the organization, being able to challenge ourselves to create those openings that would allow that, you know, job satisfaction over a long period of time for them to be able to have that. So thank you for your feedback on that today. I know home health is, it comes with a lot of challenges. Every single day seems to present a whole set of problems. But at the end of the day, how do you feel about working in home health now?
I'm actually excited about this job, and coming to work every day is, even coming to work is a challenge, but I feel supported. I know people in my office know their resources if I don't have an answer, and I'm not afraid to approach them with my questions. So it's been a really good experience, and it's given me the mentality that I know that there's room for growth, and, you know, and every day is a challenge. Every day there's another question, because these patients are all different, and
Not every patient's the same.
Yeah.
So consistency in how you approach the patient. You have to be very patient specific, I'm guessing, probably.
Yes.
And that allows us to be creative, right?
Very creative, yes.
And have some autonomy, which is important too in this phase. Well, Tess, thank you so much for your time today, and it's just been very insightful to learn about your career journey, not only within the home health space, but specifically at one of our locations. And we hope to be able to offer that to even more employees as we evaluate them and allow for some career advancement. So thank you for sharing your story today.
You're welcome.
Mhm.